Now to Eye on Education. At the end of July, Governor J.B. Pritzker signed universal mental health screenings for school children into law. Now, the law follows studies being conducted from 2023 to 2025 about student mental health and how ready schools are for a policy. It requires all school districts to offer free mental health screening to all 3rd through 12th graders beginning in the 2027-28 school year. Parents can opt their children out of it if they choose to. Now, the focus turns to how ready schools and mental health professionals are for this new process. News Channel 20 Spencer Davis joins us now after talking to the Illinois State Board of Education and a child psychiatrist about what resources will be needed. Spencer, what did you learn?
The law is going to require ISB to provide the resources and the model policies to schools by September 1st of 2026 to help them prepare. However, the concern may be a lack of staff available.
There's not enough counselors and social workers and psychiatrists and psychologists working inside of our schools.
While guidance counselors, social workers, and school nurses may be able to be of service, some schools may not have a consistent option available for these screenings.
Most schools do have a social worker and they have nurses. I would say most schools don't have a nurse who's there full time, but maybe they share the nurse between multiple schools within the same district.
ISB says they're aware of a possible staffing shortfall. They're working to address it in a couple of different ways.
This last year, we came up with a bill that actually incentivizes people to become licensed as counselors and social workers. We removed barriers so that people can come and work in public schools. And we actually started making sure that some professions that are in the mental health area can be in our teachers' retirement system, which before they had not been able to be.
The state board also sees community health partnerships as a way to help alleviate possible staffing issues.
If you talk to principals and superintendents across this state, they're all looking for ways to bring in mental health supports for their students. They're reaching out to their hospitals, their not-for-profit providers. So every district is really trying to tackle this mental health crisis that many students are facing.
Parents will have the option to opt their kids out of the screening. Communication is a primary focus throughout the process.
It would have to be explicit that, if somebody's showing signs of great distress, that they would have to contact the parent.
Now, districts won't be responsible for coming up with a screening tool. It's going to be provided to them through the Illinois State Board of Education. Reporting for News Channel 20, I'm Spencer Davis.
Thanks, Spencer. Now, our team reached out to school districts in Decatur, Jacksonville, and Springfield who either did not respond or wanted to focus on the upcoming school year at this time.
Thank you for watching. Make sure you subscribe to our YouTube channel and watch more videos from News Channel 20.